My name is Helen Brough. I am a Professor of Paediatric Allergy at King's College London and a consultant in allergy and immunology at the Evelina Children's Hospital, Guy's and St Thomas's Hospital, which is the largest NHS allergy service in the UK. I was the head of service of the Evelina Children's Hospital for 9 years, from 2015 until 2023. I'm also the director and founder of Children's Allergy Doctors, which is the private practice for children's allergies. And I am also the president of the Royal Society of Medicine section on allergy and immunology. I chose to specialize in pediatric allergy and immunology because it is such a forward-thinking and fast-moving specialty. So the research that is coming out all the time is improving the care of patients' lives. We are now able to prevent and treat eczema, food allergy, hay fever, and asthma. And we provide holistic care because we are able to deal with allergic conditions of the skin, allergic conditions of the gut, of the nose, of the lungs, and even of the sinuses and throat. So we're able to deal with all the different conditions within that individual and therefore be specialists, but still provide holistic care. What I find most rewarding about my job is the relationships that I've developed over time with the parents and children that I see in my clinic. It's wonderful to see little babies that I knew from when they were 4 or 5 months old, and then they develop into children that are walking and speaking, and that relationship with the families is just wonderful. Also, it makes me really happy to see how children with very severe eczema that first come to see me improve, and their eczema is much better controlled, and parents feel empowered to be able to control their child's eczema. Then a new service that we have developed in the last few years is food oral immunotherapy, and I find that incredibly rewarding because we see children who were highly allergic or anaphylactic to foods able to tolerate 1 or 2 of the nuts, for example, that they were allergic to on a regular basis, and see their allergy tests go down. From an asthma perspective, I see a lot of children between the ages of 2 to 18 who have significant asthma, and I'm able to diagnose this correctly, implement treatment strategies which are both safe and effective, and see dramatic improvements in their quality of life and ability to take part in lots of different things, such as sports. And then finally, for hay fever, we offer immunotherapy for various inhalant allergens such as house dust mite, grass pollen, tree pollen, cat and dog. And it is lovely to see that during this process, the children and adolescents are able to have much better lives, use less medication, have fewer symptoms, and get on with what they want to do in their lives. So that's what I really enjoy. I think that what patients most value about me and the other doctors, nurses, dietitians, and admin staff within Children's Allergy Doctors is based on the reviews that we get on Trustpilot, on Doctify, on Top Doctors, and it is responsiveness. So we have a 24-hour email responsiveness. We are able to get back to people the same day with their queries, and we provide a really caring approach for the child and their family. We understand what it is like to live with a child that has severe eczema, asthma, hay fever, food allergies, how anxiety provoking that can be, how worrying that can be. And so we want to make sure that we offer the highest quality and quick responsive service for our patients and their families. We also focus very much on the experience of the parent and the child when they come to our clinic. We make sure that there are lots of toys available and books for the children to be able to play with. We have the most wonderful nurses that do things like skin prick testing and breathing tests in a way that's playful for the children. And we want to make the experience of the family when they come to see us a really positive experience. What I value the most about the patients and the parents that I see is when the babies smile at me, when the family are happy with what's been happening and they see improvements in their child. And also I get a lot of ideas from my parents that see me in clinic because, for example, they may find a new trick on how to give their child baked egg, and then I can hand that over to other families. So I'm constantly learning based on what families tell me in the clinic, which is wonderful. So you've asked me to use 3 adjectives that would best describe the paediatric allergy and immunology profession. What I would say is holistic, because we are able to deal with all organ systems because we're specialists, but also deal with all parts of the body. The second would be proactive. We are very much focused on managing what we can see effectively and preventing what we can prevent effectively, and then also treating established allergies or respiratory conditions. So extremely proactive and forward-thinking. Thirdly, I would say that paediatric allergy and immunology specialists are responsive and conscientious because they need to be, because the families really require that fast, responsive and caring approach because of the anxiety and worry that these conditions can cause.